Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Streptococcus, we are looking at the skin as well as the soft tissue lesions. So first, we need to know about impetigo. So what is this impetigo? So impetigo, it is the infection of the superficial layers. So superficial layers are involved and it is an infection. Next is infection of the superficial layers of the skin. It presents as superficial vesicles which break down and are, so it is presents as superficial vesicles. So it presents as a superficial vesicles and they break down and are encrusted by the honey colored scab. So this presence of honey color of the scab, and it usually occurs in terms of the children. Next, moving on, we look at the erysipelas. So here in erysipelas, the infection is of the superficial epidermis. The superficial epidermis. It also presents as a erythematous raised lesion. So there is a erythematous raised lesions. Erythematous raised lesions with sharply demarcated edges. So there is sharply demarcated edges and which differentiate from the surrounding skin. So it will differentiate from the surrounding skin. Next is the cellulitis. So what is the cellulitis? Cellulitis is the infection of the skin and the subcutaneous tissue. So it involves the skin as well as subcutaneous tissue. So what can it present with? The cellulitis, it can present with the erythema and the edema. So it presents with the erythema. So there is erythema, there is also presence of the edema. Then it can be differentiated from the erysipelas. So it is differentiated. So differentiated from the erysipelas, and this is by. So erysipelas by the erysipelas is a raised lesion. It is a raised lesion. Whereas the cellulitis is not. So the cellulitis, if you see, it is not. The cellulitis is poorly demarcated. If you look at cellulitis, it is poorly demarcated from the surrounding skin. Whereas erysipelas is clearly demarcated. Erysipelas is clear demarcation is present. Next, we look at the necrotizing fasciculitis. So in the necrotizing fasciitis, so here the infection involves the facial planes. So the infection, it involves the facial plane. And it presents at the dark areas of necrosis, erythema and the edema. So there is presence of dark areas. So this dark areas, it involves the necrosis, erythema. So the presence of necrosis, the presence of erythema, as well as the presence of the edema is there. Lastly, we look at myositis and the myonecrosis. Myositis as well as the myonecrosis. So this is basically the infection of the muscle. So infection of what? Infection of the muscle. To learn and grow daily like this, please do subscribe.